To clear the groin or inguinal nodes, we will use our stationary circles. We will perform semicircle medially superiorly and let the skin spring back. After that, I will start sweeping from the medial aspect of the thigh. So with relaxed hands covering as much area as I can, I will be sweeping on one area 5 to 8 strokes, and then I will be moving proximally towards the groin. Five to 8 strokes, and I will be moving towards the groin. Once I have medial thigh covered, I will move to the lateral aspect of the thigh, and I can, to have more access to it, I can just medially rotate their leg, and I'll start sweeping from just above the knee towards the midline. 5 to 8 strokes, nice and slow, and then I will be moving proximally towards the groin. So direction of our stroke is superior and anterior, so towards the midline on the anterior thigh. Then I will be moving proximally. Five to 8 strokes. I'll finish off with 5 strokes directly towards the groin on the midline. Then with cupped hands, I'll be clearing both aspects of the knee. So starting right underneath the knee, my thumbs are showing the direction. So the direction is superior, so just over the knee joint. And I'm trying to cover both aspects of the knee joint, as much area as I can. 5 to 8 strokes. My next stroke is with just the hand that is closer to my client. I'll be sweeping from mid-calf, and I'll try to go on the posterior side of the knee, so from the popliteal area, and then scooping it out towards the midline. So kind of like scooping from the posterior knee towards the midline of the thigh. 5 to 8 strokes. In addition, I will do thumb twisting circles, which are very good strokes, particularly if the edema is in the knee. So we'll be focusing on the visible edema around the kneecap, and we'll be performing those thumb twisting circles around the kneecap, 5 to 8 at the same area. Yeah, so wherever the edema is most visible. After that, I will repeat just general stroke for sweeping the knee. After clearing the knee joint, we'll come to the lower leg and starting on the medial, just above medial ankle. And very similarly to the medial thigh stroke, we will be sweeping 5 to 8 strokes on one area and moving proximally. So the direction of the strokes is once again superior and anterior towards the midline of the anterior leg. 5 to 8 strokes. Then I'll move to lateral aspect. So I will move the ankle medially and I will sweep from the lateral aspect of the anterior leg, and I'll be moving progressively towards the knee. Five to 8 strokes, one area, and moving proximally. After that, with cupped hands, I will be sweeping across the ankle. So, just as before we did with the knee, we'll place our hands just inferior to the ankle and we just sweep through the joint, trying to cover as much area around the ankle as we can. So the more relaxed hands, the better, because then we will just adapt to the client's curvature. 5 to 8 strokes. After clearing the ankle, I will go on the dorsum of the foot. So really the section where the fluid gets really stuck is just on the dorsum of the foot above the toes. So with very similarly to the hand, we will use flat thumbs just to stroke over that section of the dorsum of the foot that gets really puffy and swollen. Then we will change to alternating thumbs. So one after the other, covering as much area with our thumb as possible. Then we can just sweep the whole leg. So from below the ankle, we'll go all the way to the groin. 3 strokes. And additionally, we'll cupping hands, alternating hands, we will be stroking towards the midline. So from the table towards the midline. And one more time, cupping hands towards the midline.